Hi, thanks for signing
Hello.
in today.
Thank you. Yeah, nice to be here.
All right. Are you in a space? It looks like you're in your usual spot, feeling comfortable, private.
Yeah, yeah, no one's around, so I'm free to talk.
All right. How's your past week been?
It's been good. I've been thinking a lot about like mental health stuff that we talked about. And I've been feeling pretty good, so it's been a good week.
Okay. Yeah, I was going to actually check in and see if you had a chance to check out the mental health resources and a couple of the therapy options that we talked about through your insurance, and if you had any questions or.
I did. I checked out a couple. Um, I don't have any questions at this time. I think I just need to like have a couple that I need to follow up with and like set up appointments. So,
Okay.
um,
How do you
yeah.
feel about doing that? Is it bringing up anything for you or?
Um, no, I think it was, really helpful to talk a little bit about like how common those things are last time. And so, um, I think that, I'm just hoping I can find someone that I work well with. So that's kind of my biggest thing now is hoping that, I find somebody and I like them and are able to work together.
Yeah, yeah.
Mm.
That's great. Sounds like you were able to look into it and that hopefully, being able to set up a couple of appointments and find someone that you can connect with.
Yeah, totally.
So I know our past couple menu sessions, we've been focused on housing and looking at mental health support. And I guess I just wanted to check in with you. We'd also mentioned substance use, and how that was something that you've been dealing with, especially in the past few months with the passing of your friend. And so I wanted to see if that was something that you were interested in maybe exploring for a few minutes in this session.
Yeah, that would be good. Yeah, that definitely goes hand in hand, I think, with my sadness. So, yeah.
Yeah. Tell me a little bit more about how you feel like they're connected.
Well, when I first moved to San Francisco, I was just using like when we would go out and party, like we would, go out and dance, and I would use a little bit of Coke. And then my friends and I started using meth and drinking it, but it was all kind of related to going out. Um, but recently I started smoking a little bit of meth daily. And it's just kind of like a way to get out of bed, especially if I'm feeling pretty sad. Um, so yeah, it's definitely increased recently.
Okay. And I know that kind of mirrors what we talked about last time too, a little bit, and how, um, you know, how you're kind of using it to help give you energy when you're going out, or like you said, maybe waking up in the morning and kind of feeling low energy. But then the calm down and the after effects actually kind of leave you feeling more depressed oftentimes. And then you end up maybe feeling
Mhm.
like you need to take it again just to feel okay for the morning or the day, or giving you that
Yeah,
extra boost.
totally. Yeah. So it's like a vicious cycle.
Yeah. And that, sometimes it can get in the way of your physical health too. And I know we talked about that a little bit, like getting colds, lowering your immune system, which then can
Hmm.
sometimes also increase when you have, those depression feelings and
Hmm.
irritability, low energy, which affects the
Yeah.
housing too. So it sounds like they're
Hmm.
all kind of interconnected.
Yeah, they totally are. And I guess I never thought of it that way, but I guess like using kind of prevents me from working on my goal of getting housing because it kind of makes the sadness worse, sort of, or like keeps me in that funk where like longer. Um, so yeah, I mean, if my biggest priority is housing, so like I'm really motivated to like try whatever I need to get housing. Um, and I never thought of like substance use maybe being in the way of that. That's an interesting thought.
Yeah. And it sounds like maybe if you were able to have some support for some of these sad feelings, maybe a little more support or some different coping some other ways of coping, that might be something that would be helpful for you also in meeting your goal of housing.
Yeah. I mean, totally. I think also like spending less money on meth would help too, because right now I just have to like couch surf with friends, but maybe I would have enough money for like a hotel or a room or something like that. If I wasn't spending so much on meth.
Yeah. Yeah. Giving you a chance to kind of be a little more independent, which would also help you to feel, it sounds like, help your mood to increase
Hmm.
and
Maybe.
give you some more independence and space.
Hmm. Yeah, it could be. Yeah, I never thought of that, but I think you're totally right. Like, I think it certainly would give me more money, which would make things a little easier.
Yeah. And I hear that, often too from individuals um, that are dealing, with substance use and daily. And it's often something that, like we also talked about, that affects, um, multiple areas of life. And it can really be, um, it's something that's quite common, and when
Mm,
you, especially with PTSD and some of those things that we talked about, because
mm,
when those symptoms come up, being able to have that can be like that short-term help that you need. And then maybe in the long term, it actually kind of leads to continuing some of these problems or challenges.
yeah. 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 I could see that. I mean, I definitely think that people who haven't been through the stuff going through, like they don't seem to need to use like I do. So, like my friends still can just like, do a little coke when we go out and dance and that's it. But I'm definitely aware that I'm using differently than them.
Yeah. And it can be helpful to recognize that connection of
Mm,
PTSD and of some of the mental health struggles with substance use, and being able to see how they are connected, and
mhm,
how it's a real thing,
mhm.
because there's a lot
Yeah.
of stigma and a lot of things involved in it. But like you said, a lot of people don't know unless you've been through that. It's really challenging to know.
Yeah. Yeah. Yeah, I mean, I would love to be able to just use like my friends, like just kind of, when we go out and party or whatever. But I'm just not sure how to like cut back from daily.
Okay.
Yeah.
So it sounds like it's important to you right now to maybe think about using in a safer way, where you're partying with friends or things like that, and then maybe using less to have more energy in the long term for some things like housing, to help you with housing and just to feel better overall.
Yeah, I think we use I think I use pretty safely, but I think I just want to be less dependent on it for like day to day. Like I would love for it to just be like something as a treat.
Okay.
Hmm.
Yeah, I think that it sounds like that goal is something that, how confident are you that you could make a change in meeting that goal if we, continue to work on it? Maybe I could send you some resources. And kind of like we talked about too, there are actually classes and things specifically for individuals that have PTSD and substance use that can be really helpful, that can help you delve a little more into that. So it kind of makes that
Mm,
mental health piece and the substance use piece. And a lot of times with the substance use support groups or recovery programs, depending on what might be the right fit for you, you can get some extra support in that area.
mm. I don't know. I'm a little worried about just like how I might do just quitting. Like, cause like I said, I use it almost like as a cup of coffee every day, like to get myself out of bed and get going. But I do think I'd be really interested in like checking out some resource like where people like me are having trouble with both like, substances and mental health stuff. Um, I don't know if I'm Yeah, I can't imagine just like cold turkey quitting it right now, but I think I'd be really interested in a group like that.
Yeah, and I really appreciate you, talking about that and sharing that too. And
Mhm.
like you're saying, hopefully a group too, where the goal is not just to quit, but to use safely and use in a way that's important for you, that's empowering.
Yeah.
Hopefully that's a resource we can find for you too.
Yeah, that would be perfect because like I don't see myself not ever using, but I would like it to be more so where it doesn't impact me and my ability to like find housing.
Okay. So do you have days when it sounds like you're mostly using daily. Has there been any days where you haven't used in the past few months?
Um yeah, like when I hung out with one of my friends who's really involved with AA, I didn't use before going to see her.
Okay.
Mhm.
So maybe when you were like able to hang out and have a nice time with your friend, then that sort of distracted you and gave you it sounds like maybe a positive thing to do instead.
Yeah, I guess you could say that. Yeah, I was kind of woke up and I was excited about seeing her. And so I didn't really feel like I was sluggish or needed to use. Um, it was like I had kind of had something to look forward to. So,
Okay.
mhm.
How would you feel about me sending you a resource and maybe this week kind of identifying some of your safe coping skills, things that might help you when you first wake up in the morning, like things like that, like maybe hanging out with a friend or doing something positive, reading. Some people like to read a poem in the morning or watch a video. Um,
Mhm.
and it
Mhm.
just kind of has some different options. It has like several pages of, just options and things that might be helpful.
Mhm. Mhm. Yeah. So, like things to do in the morning instead of using to kind of have energy is what you're saying.
Yeah, exactly. And it's just sort of a
Mhm.
list. So maybe you could go through and this week and just circle a few things that you feel like might be helpful for you. And then you'll kind of have that there. Some people like to just print it out and have it next to their bed when they wake up in the morning, just as a kind of reminder that there are some other things that make them feel good too.
Mhm. Yeah, I think that would be good. Be down to
Okay.
do that.
Okay. So I'll send you that. And then I'll also send you some of those like mental health and substance use support group that we talked about options.
Mhm. Mhm. Okay, that sounds good.
Okay. What are your thoughts as we're kind of wrapping up and just talking about substance use a little more? What are your thoughts?
I like the idea of being able to have this like more casual relationship with math, like where I'm just using for fun. Um, it's such a big part of like getting me out of bed right now. So I am a little bit like concerned about like being able to do that without it, but I like the idea of like trying.
Yeah. And I hear that it's a big step. Even
Yeah.
just even just, being able to say, okay, I'm gonna try this new coping for 5 minutes.
Mhm.
And,
Mhm.
even just practicing, it may not always go perfectly. And, there are ebbs and flows and days where it'll be a really good day, and then days where it might be more challenging and you might just have a
Mhm.
harder time. And that's okay
Mhm.
too. So
Mhm.
being able to give yourself kindness through the process of doing this really big new thing sounds like it's
Mhm.
something that's also important as you're kind of trying new things and stepping outside of your comfort zone.
Yeah. Yeah. Yeah, I agree. I'd be down to give it a shot, which would be
Okay.
cool. Yeah.
Yeah. And having that extra support can also be really helpful because then you can hear from other people who, are in a similar position as you, and that can be really meaningful too.
Yeah, I'm looking forward to that, like, having people like, more people that are like me, um, and maybe I could even learn a little bit more about, like, where they get help with housing if they have trouble with that too. Um, So yeah, I mean, I like the idea of giving it a shot. Um, that's all I can do. Like, hopefully it works out, but I'm down to
Okay.
try.
How confident do you feel that you would like to try that this week? Like on a scale of 1 to 10, if 10 is like, yes, I can absolutely do it. And maybe 5 is like, not quite sure. How are you feeling?
I think I'm really confident that I can try it. Like, try the. We're talking about the thing in the morning, right?
Oh, yeah. Yeah.
Yeah.
Sorry. Yeah.
Um, yeah. I think the only thing that might get in the way, like, is if I had something planned to do in the morning, and then like I randomly like wake up late or like have a housing thing, like, so I would say like a 9. If that doesn't
Okay.
happen, I think I'd be confident to try.
Okay. Yeah.
Hmm.
That that sounds good. I appreciate your willingness to think about it.
Yeah.
Like I
Yeah.
said, stepping outside of your comfort zone. And I'm looking forward to hearing how it goes. And please feel free to email or text if you have any questions or anything
Yeah.
like that comes up.
Okay, that sounds good.
Okay. All right. Thank you again for meeting with me today. And I'll look forward to meeting next week. I have you down
Okay,
for the same time. So just let me know if you need to make any changes.
will do. That sounds good. Thank you.
Thanks. Bye.
Bye.